Hello, I am Dr. Trivedi. Uh, may I confirm that your wife of Mr. Robert Downey,
Yes, doctor.
43
Yes,
year
yes,
old,
yes, doctor. Yes, I am.
yes, well, uh, I'm going to talk about some health issues of your husband. Will that be okay?
Yes, doctor. I am worried about this condition. Please.
Yeah, yeah. May I know that how far have you known about his condition?
Actually, for a couple of days I was far away. So this morning, my one of my neighbor called me that and said that my husband's condition isn't good, and he has been taken to the emergency department. And after hearing this, I came on a long trip journey. So how his condition is now, doctor?
Well, actually, he was very unwell at that moment, and we actually gave him the best treatment possible. And actually, he had a very big heart attack, and we, although we gave him a very good treatment, we gave him a medication through his blood channels, so that his the blood channel that was blocked off can be opened up. But actually, he had a very big heart attack, and the damage was quite great. And I'm sorry to say that the news is not too good, actually. Although we tried our level best.
What do you mean by not good, doctor?
Yes,
Can you
actually,
clear me that?
yeah, actually, although we gave all our medication, the heart couldn't beat properly, and I'm very sorry to say that he passed away.
Faster? What do you mean by that?
Uh, actually, I'm very sorry, very sorry, but to say that actually he's no longer with us. Actually, he actually died during that.
Hi, doctor. What are
Battle.
you saying? Are you serious? You might be just kidding, doctor. He cannot die. I was just yesterday. I talked to him, and he was totally fine. Are you serious that you are talking about Mr. Robert Downey?
Yes, yes. Mrs. Tony, I'm very sorry to say that
No,
I'm
doctor. I
talking
think
about.
you're making something wrong. I don't believe
I'm,
that he is dead. He was totally quiet. He was a totally quiet, good person with good physique, and he didn't have any medical condition or any disease. I talked to him. You are just talking about another person.
uh, I can get it, Mrs. Downey. Actually, I can understand your condition. Uh, I can understand that that things are very difficult for you now. But may I continue, Mrs. Downey?
I will continue. Are you sure, doctor, that he is Mr. Downey?
Yes, actually, yes, Mrs. Downey. Actually, we have checked and double checked it, and I think I'm sure that
Now he's dead, doctor. What are you saying?
yes, I'm.
But it is quite impossible, doctor. It cannot be happened. I wasn't present at the time, and I wasn't present for a while, and in the meantime he died. Can it be? She's so pathetic, doctor. He was totally fine, and we have a we have just a 1 year old boy.
Yes, yes, I can. I'm very sorry. Very sorry, Mrs. Downey. Well, can I please? Can you please
Okay,
have
can
the?
you please give me 1 minute? I cannot
Yes,
be here talking.
yes, yes, Mrs. Downey. Please take your time.
Okay, doctor, what happened to him?
Well, actually, uh, Mrs. Downey, would you like to have a sip of water now? Actually, it's very difficult time for you. I can understand.
No, doctor. What happened to him? Just
Yes, actually, may I continue though now, Mrs. Downey? Yes, actually, I can understand it's a very, very hard situation. And actually, when Mr. Downey came, he actually came with severe chest pain, and we at the time ran the tests, and actually, he had a very big heart attack at this moment. And despite giving the best medication we could, uh, he couldn't survive. Actually, okay. So,
doctor,
uh,
just
yes,
one thing that I heard one of my relatives. He had a heart attack and he was a very old person, but he survived with good treatment. Was there any fault in the treatment? Was there anything wrong? Just
it,
please, don't anything hide anything from me.
yeah, yeah. Well, I understand, Mrs. Downey. I can understand your anger and your condition now. It's true, yes, Mrs. Downey, that many people can survive heart attack, but I am afraid to say that many people also don't. And in this case, in your husband's case, unfortunately, the heart attack was to be. The damage was very extensive, and at times, what happens that there are some mechanisms in the heart that helps to beat it properly. But unfortunately, that was also hampered in your husband's case. So, despite giving the best treatment and the treatment what we gave through blood channel, it's the standard treatment everywhere. Despite giving this, we couldn't make him survive.
Okay, doctor, you said that his heart wasn't working, but I heard that in the ICU department, there are ICU department, they can keep patients heart active, keep patients heart active for a long time. And I saw many person even they were unconscious, totally unconscious, and they were keeping in the machine, and after a few days they became very well. Couldn't you do that for him?
Well, actually, uh, in the we are very sorry, actually, Mrs. Downey, uh, but actually, that is not the case. Actually, in the ICU, what we usually do is to keep the breathing alive. Okay, and that time we usually helping with some breathing machine. But in your husband's case, it was not about the breathing. Actually, it was his heart that was damaged, and we couldn't have that artificial help to be given to him. We are very sorry, Mrs. Downey. That was not possible, actually.
Okay, doctor. I think it was my bad luck, and I think it was my bad luck because I wasn't with him. I went on a trip to on my work trip, and that was I cannot forgive myself if I were with him this time. I think I could save.
Uh, I'm very sorry, Mrs.
It's
Downey,
totally
but
my fault, doctor. It is totally my fault, not your fault. I cannot even forgive myself.
Mrs. Downey, I'm really really sorry for your condition, but actually, may I just tell you one thing? May I, if you allow me? I know it's a very difficult condition for you, but actually, may I continue, Mrs.
Okay, doctor.
Downey? Well, actually, he was admitted actually quite early. It's not that he was admitted later on. And actually, it's at the time when he came, the damage was indeed quite extensive. So uh, I can understand your pain, your agony now, but I don't think that you should blame yourself for this accident, for this incident. Actually, but and
Okay,
may I
doctor.
actually, yes,
Can I see him now?
well, actually, there are some issues. May I? may I actually say you now?
I just want to see him, doctor.
Yeah. Well, yes, I can understand, but may may I inform you something now, Mrs. Downey?
Okay.
Well, actually, mm, this is although your husband died of a heart attack, but actually it's till it's yet it's actually an unexpected death. Okay, so we'll have to inform the coroner at first. Uh, just we have to inform it actually, although we don't think that we need to do any examination on him, any post-mortem on him, but we have to inform the coroner at first. Are you getting me, Mrs. Downey?
Okay, doctor, do whatever you want, but just give me a chance to see him.
Yes. I will immediately talk to the consultant in the ICU. Okay, so that as much as can be done in this case, but we just have to inform.
Minutes remaining.
Yeah, we just have to inform the coroner. Although it's highly unlikely that a postmortem will be done because we more or less know about the cause of his death. uh, and I will talk immediately with the consultant in charge to help you in this matter. Um, I can understand it's a very bad situation for you, Mrs. Downey, and do you want to actually I think I can understand, but may I help you in any other case, in any other way? I know that it's impossible to help you, but yet I would.
Yes, doctor, we don't have anyone here. We are just living alone. Can we make anything arrangement for his funeral or anything else?
Sorry.
Can we make anything for his funeral?
Yes, Mrs. Downey. I will immediately talk to the social services in this matter, so that they take up this matter very seriously and help you as much as possible in this matter. Okay, Mrs. Downey.
Okay, doctor.
Any way more may I help you?
No, doctor. Just can you inform his family?
Yes. If you want to, Mrs. Downey, that and then we can do that from our hospital uh, as well. But you might think again whether you want to inform them on yourself or whether you want us to inform them. It's up to you, Mrs. Downey. Okay.
Time off.
Okay. So, is there any more question, Mrs. Downey?
No, time off and stop.
Oh,
Okay, what was the task?
actually, it was to inform Mrs. Downey that Mr. Downey is dead.
What do you think that you could tell him in a proper way or in a good way?
Uh, well, uh, I don't know actually, but I have to. Uh, I tried my best actually to actually breaking this bad news slowly. I didn't want to go so fast, and I actually broke down the news slowly so that she can get it. And actually, although it's a very bad news, so it took time for her to get into it. Actually, I think.
Okay. And what do you mean by passed away, not among us?
Okay, well, I think passed away. I don't know, but whether it can be told about death, I think.
I think if he's dead, you should tell without any ambiguous word that you should directly say that I am sorry to tell you that he is dead.
Okay. Okay.
And after that, one thing that other thing was but one thing that patient was at shock, and she was more sorry, the person was at shock and she was mourning, and at that time you were wanted to continue your conversation, or you were trying to deliver your news. Was it appropriate manner, do you think? What do you think?
Sorry. Can you please repeat? I couldn't get it.
The person was mourning at his husband's death, and you were trying to continue your conversation. Was it a right manner, or was it a good manner? What do you think?
Uh, I don't know whether there is any specific time span for it. I don't know of it.
You didn't allow her any time to absorb.
Well, I asked her that should I continue or should I?
Okay, she was mourning at the time, and she was just shocking. Then she was just absorbing the news, and at that time you were repeatedly saying that should I continue? Should I continue?
Okay, well, I just should have been kept. Should have kept my silence. Did
Yes,
you?
you should have been kept silent for a while.
Okay. At the time of mourning, I just should keep silent. Is that
Yes.
right?
Yes. After that, after if you suppose half a minute, if patient is if the
Okay.
person isn't saying anything, then you can approach. I can understand that you are going through a very bad time.
Yeah. Mhm.
Should I continue, or can I do anything for you now?
Yeah. That was very important. Okay. Mm.
And after that, I was asking that can I see his dead body, and you were going to talk about the official procedure. Was it right thing?
Well, I actually was not sure that whether it's possible to let her see at the beginning. I was not sure about the procedure.
Why she cannot see?
Uh,
Is it any communicable disease or anything else that can spread?
no. So I think I should have told that.
She can see in a separate room. After that, in the meantime, you are going for your official procedures.
Okay. Mm. Okay. Mm.
Okay, fine.
Okay.
Thank you.
And other any more thing to be added?
Yes, patient's wife was sorry, the person's wife was talking about his children.
His
They have
children.
they have a 1 year children. So you could have make any arrangement. If,
Well, I just missed it. When did she tell it? I just couldn't get it. I think at the beginning.
okay.
I just
Yeah,
couldn't get it.
at the beginning, she said, "Oh, he has died. We have just
Oh, I just
we have just 1 year children. What I am going to do?"
I just couldn't get it actually. That was a big mistake. Yeah. Okay. Yeah. So anything to add?
As far I can remember that this is
Well. Uh, should I mention the word about coroners here, or just tell that okay, you can of course see we will make arrangements as soon as possible,
yes.
and at the same time
Yeah,
we will begin the official.
I am informing the ward nurse to make an make an arrangement to visit his to see his body, and in the meantime, I am going to make some official procedures. Or if she asks that, do I need anything to be aware of, then you can say.
Okay, and if she tells that I want to know more specific about it, if she tells like that, since it's a young onset death, actually cardiac death, should I tell that you might go for hospital post-mortem or something like that?
If she asks, if she demands, then we can take opinion from the consultant and coroner's department. They will be able to give
Okay,
the explanation.
okay,
I
and
am not the person to give any opinion.
okay, And another thing, if she wants to lodge a complaint, what would be the case? It will be it will go on the coroner's jurisprudence again.
Okay, and if you don't know, and I don't know, I can say that okay, I am going to ask this, and I am going to help you on that way to complain against.
Sorry.
I am going to I will ask someone who knows it, or I am going to ask the hospital authority about the procedure, and I am going to I am coming
Okay.
later to inform you about that.
Okay, that's good. Okay, that's good. And may I know what about the what are the ethical issues in this case? Is there any ethical issues?
I cannot remember anything.
Okay, but there are some legal issues like coroner's examination, I think, and uh, any other legal issues here?
His some financial or banking, any insurance policy.
Yeah. Insurance, financial,
So
and also I think coroners.
yes,
Okay, and any other thing?
no, I cannot remember. I have to read this.
Okay, and I think you can just stop the recording, and then we can discuss.